Good evening, wherever you are. This is Nova Quinn from ConferenceHype. Our segment will focus on mineralocorticoid receptor overactivation in heart failure with preserved ejection fraction. From the 2026 August 3 edition of European Heart Journal. Background: heart failure with preserved ejection fraction is a heterogeneous syndrome encompassing hypertensive left ventricular remodeling with diastolic dysfunction and systemic inflammation-driven endothelial dysfunction, with possible contributions from visceral adipose, tissue-associated metabolic, and proinflammatory alterations. Methods, however, conventional key risk factors for HFpF, including advanced age, female sex, obesity, diabetes, and chronic kidney disease, are closely associated with mineralocorticoid receptor overactivation through several under-recognized mechanisms. i.e. results, however, conventional key risk factors for HFpF, including advanced age, female sex, obesity, diabetes, and chronic kidney disease, are closely associated with mineralocorticoid receptor overactivation through several under-recognized mechanisms, i.e. discussion. This paper presents the mechanistic pathways linking MR overactivation to HFpF and highlights the potential benefits of mitigating MR activation for its prevention and treatment, calling for renewed consideration of treatment strategies in clinical practice and trial design. From the 2026 August 7 edition of European Heart Journal. Background: conduction disturbances and permanent pacemaker implantation remain the most common complications after transcatheter aortic valve implantation. Methods: the strongest predictors of conduction abnormalities and subsequent permanent pacemaker implantation after transcatheter aortic valve implantation include pre-existing right bundle branch block, a short membranous interventricular septum, deep transcatheter heart valve implantation, and valve type. Results: importantly, both new permanent pacemaker implantation and new left bundle branch block after transcatheter aortic valve implantation are associated with increased mortality and heart failure hospitalizations. Discussion: this review aims to provide an overview of the incidence, pathophysiology, and consequences of conduction disturbances after transcatheter aortic valve implantation, discuss preventive strategies, highlight the relevant ongoing studies, and provide an evidence-based framework for the management of this important clinical issue. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, heart failure with preserved ejection fraction is increasingly recognized in the general population, but the prevalence among adults with congenital heart disease is not well described. Methods: using the electronic medical files, a retrospective, multicenter cohort study was conducted including 4507 OCT patients with biventricular heart physiology and systemic left ventricle, followed at the ACHD centers in eastern Denmark. Results: among 4507 OCT patients, 86% had a preserved LVEF. Discussion: heart failure with preserved ejection fraction is highly prevalent among ACHD patients, regardless of ACHD severity. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, up to half of patients switch or discontinue antihypertensive medications within the first year, but underlying mechanisms remain elusive. Methods: using longitudinal medication data from 400 genotyped antihypertensive medication users across 3 cohorts. Short-term antihypertensive medication use trajectories were classified as continue, switch, or discontinue. Results: in total, 14 genome-wide significant loci were identified for switching from angiotensin-converting enzyme inhibitors and dihydropyridine calcium channel blockers to other antihypertensive medications. Discussion: these findings extend the bradykinin hypothesis of ACEI-induced cough by implicating neurotensin NTSR1 signaling. Pinpoint CYP3A4*22 as a novel functional predictor of DCCB switching with potential for genotype-guided prescribing, and validate medication use trajectories as a framework for pharmacogenetic discovery. From the 2026 August 5 edition of European Heart Journal. Background and AIMS, binary classification of adverse pregnancy, outcomes may obscure differences in women's long-term cardiovascular disease mortality. Methods: a total of 1,409 women with complete pregnancy histories were identified from the Medical Birth Registry of Norway and linked to the Norwegian Cause of Death Registry for premature CVD mortality. Results: for composite APOs, women with APOs in first pregnancy and no further pregnancies had the highest CVD mortality, followed by those with APOs in both first and later pregnancies. Discussion: considering APO sequence across complete pregnancy histories provides more detailed CVD information than binary classification. From the 2026 August 5 edition of European Heart Journal. Background: cardiac computed tomography plays an established role in the assessment of cardiac patients. Methods: in this document, the aim is to demonstrate and clarify the role of CCT in the clinical management of heart disease. Results: this document will cover the clinical indications, prognostic values, and limitations of CCT in the diagnosis and follow-up of heart disease, including ischemic heart disease, valvular heart disease, cardiomyopathies, cardiac masses, large vessel disease, and adult congenital heart disease. Discussion: therefore, this document outlines the technical principles of CCT and its use in everyday clinical practice for cardiologists who are not experts in CCT. From the 2026 August 7 edition of European Heart Journal. Background and AIMS, calcific aortic valve disease lacks effective pharmacotherapy and is tightly linked to aging. Methods: this study combined integrated human aortic valve bulk RNA-seq with single-cell transcriptomics to map NAD+ pathways. Results: in aged human valves, NAMPT-mediated salvage exhibited the steepest suppression within valvular endothelial cells, triggering NAD+ depletion, SIRT1 inactivation, and hypercetylated nuclear factor kappa B, thereby resulting in an ICAM1-rich inflammaging profile. Discussion: calcific aortic valve disease is initiated by endothelial NAD+ insufficiency and magnified by metabolically diverse macrophages. From the 2026 August 7 edition of European Heart Journal. Background: tricuspid regurgitation is a common yet historically neglected condition associated with poor outcomes. Methods: traditionally managed conservatively, TR has recently gained renewed attention, thanks to advances in surgical and transcatheter interventions. Results: tricuspid regurgitation is a common yet historically neglected condition associated with poor outcomes. Discussion: by harmonizing diagnostic standards and promoting a structured approach to patient assessment within HVCs, this review aims to facilitate timely referral and ensure consistent evaluation and management of patients with this complex and often underestimated condition. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, this study investigates the clinical course and long-term outcomes of adults with subvalvular aortic stenosis. Methods: adults with SAS prospectively registered in the Dutch Congenital Core Visscher Registry between 2001-2019, were included. Results: overall, 312 patients were included with a median follow-up of 16 years. Discussion: survival of adult SAS patients with a history of SAS repair was substantially lower compared to the unoperated group, reflecting a potentially more severe SAS phenotype. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, intake of ultraprocessed food is positively associated with arterial hypertension. However, the association with specific markers of ultraprocessing has not been assessed so far. Methods: this exploratory prospective cohort study included 101,560 non-hypertensive UK Biobank participants who completed at least one 24H dietary recall. Results: over a median follow-up period of 10.5 years, 7633 hypertension cases appeared. Discussion: only some MUP categories, i.e. flavor, coloring agent, sweetener, and varieties of sugar, are positively linked to incident arterial hypertension. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, congenital heart defects aggregate in families, but recurrence patterns across kinships and generations remain incompletely understood. Methods: a retrospective, population-based case control study was conducted, including 51,778 individuals with CHD born between 1987 and 2017, and 522,543 matched controls. Results: among individuals with at least one affected relative, the OR for CHD was 2.71, increasing with each additional affected relative. Discussion: congenital heart defect in a relative is associated with CHD in the index individual, with recurrence patterns varying by kinship and number of affected relatives. From the 2026 August 7 edition of European Heart Journal. Background: three-dimensional echocardiography has become an essential tool in the evaluation and management of valvular heart disease, offering superior accuracy and detailed visualization when used with the transthoracic and transesophageal approaches. Methods: the rise of transcatheter valve interventions, particularly for high-risk or inoperable patients, has underscored the importance of 3D imaging in guiding these procedures. Results: 3D echocardiography allows for precise assessment of valvular anatomy, quantification of regurgitation, and visualization of complex lesions, contributing to better procedural planning and outcomes. Discussion: this review highlights the growing role of 3D echocardiography in the management of VHD, emphasizing its evolving technology and applications in diagnostic precision and procedural guidance. That's it for now for ConferenceHype's coverage of the August 2026 issue of European Heart Journal. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.